Hello, everybody, and welcome back to DTV, the Digital Transformation Channel. My name is Leila Modarres, and I'm very excited today to bring you Sanjeev Agarwal, who is the President and CMO of LeanTaas. Welcome to DTV, Sanjeev.
Thank you.
Might I also add that Sanjeev was also the first product marketing person at Google in the .com era. So very excited to have you here to bring us some perspective on that. I also just read that LeanTaas was listed by CB Insights as one of the top 100 AI startups. So congratulations on that. And from what I understand, you guys are providing better healthcare through analytics and predictive analytics and also mathematical algorithms. So can you tell us a little bit about how that works? That sounds really interesting.
Sure. So if you think about one of the biggest problems in healthcare is just access to healthcare. So we have 5,000 hospitals in this country that have put a lot of assets in the ground. Mm-hmm. They've built operating rooms, infusion centers, inpatient beds. The problem we solve is, are they using these assets as well as they could? So you could call it doing more with less, driving more operational efficiency. And if you dive one step deeper into that problem, there is a big mismatch between how these assets are built, the supply of these assets,
right,
and how they're used, the demand for these assets. So to give you a practical example from everyday life, you might call for an MRI exam and be given an MRI appointment, say 2 weeks from now. Mm-hmm. But if you stood next to that MRI machine between now and 2 weeks from now, mm-hmm. Between 7 a.m. and 7 p.m., there will be many periods of 20, 25 minutes where the machines are not being used. And when you show up for the MRI appointment, it's not going to take more than 20 or 25 minutes. Or you might even have to wait when you show up, despite not having gotten the appointment for 2 weeks. So you got to think about that for a second, right? Why is it that I can't get use of an asset for so long? When I show up, I have to wait, and yet half the time the asset's empty. So the problem we're solving is making each asset more efficient. How do you see more patients in infusion chairs faster, give them chemotherapy treatment faster, for example? They wait less each time they show up, and more of them are fit in those infusion chairs every day.
Right.
Similarly, how do you get more surgeries done in the same number of operating rooms you have by allocating capacity more specifically and better on a daily basis?
Mm-hmm. And time is money, and these assets also, if they're sitting there stagnant, I'm assuming that is costing the medical facility a lot of money.
Absolutely, and this isn't cost that they see in their operating budget, but it's sort of like Southwest Airlines buys 10 planes, and then if half of them are empty, mm-hmm. or half of them are flying half empty, mm-hmm. both of them are bad situations. And if you think about what airlines have had to do, airports have had to do to improve throughput, a lot of it is based on doing a few things that healthcare still doesn't do.
Right.
Things like appointments are booked like tennis court reservations when you show up to see a doctor. Well, what's the difference between a tennis court and a clinic appointment? Mm-hmm. If I have an 8 to 9 tennis court at a club and you have a 9 to 10, at 9 o'clock you can show up and kick me out because you have the 9 to 10 reservation.
Right.
The problem is a healthcare appointment is a series of small steps, each of which has some variation to it. It's called stochasticity. Mm. Now, it's not like a tennis court reservation, because if you show up at 9 o'clock and I'm still occupying that room, you can't kick me out. Mm-hmm. And now if you have 70 patients showing up on a given day,
right,
and each of them has a little variability in how long it takes for the nurse to do my vitals, to get me seated in the room, how long it takes the doctor to show up, or the doctor is delayed with one patient. All of these things lend themselves to a brutal day.
Yeah, and it's not going to get any better, as you have something on your website that says 20% of Americans are going to be over the age of 65 by 2030. So, are we going to be ready for this?
So look, it's not as if we don't have enough assets on the ground. If you think about 5,000 hospitals, each having spent, say, $200 million in building this infrastructure,
right,
that's $1 trillion of capital that's been put in the ground, mm-hmm. right? Mm-hmm. But the turns on these assets is very low compared to any other industry out there. So 20% of Americans will be over the age of 65 by 2030. even if the population rises by 1% each year between now and, say, 2040, we'll be a country with more than 400 million people. Okay, 1 out of 2 Americans has a chronic disease, back pain, cancer, something with arthritis, something like that. And the fourth stat is that the number of times someone sees a doctor or gets medical care is a U-shaped curve, meaning before the age of 10 and after the age of 60 is when most of us use medical care. Mm-hmm. So you take these 4 factors together, what you're essentially saying is that the demand for medical services is going to grow at 30, 40, 50% for the next several years. And the only way we're going to be ready is to be able to use our existing assets as well as we possibly can.
Right.
And so we're trying to get the level of sophistication in how we make demand-supply matching decisions to be much more like the airline industry or much more like other asset-intensive, highly variable industries.
And going back to how you do this, the CB Insights Award recognized you for your use of AI. So how are you leveraging artificial intelligence or machine learning in this effort?
The simplest way to think about what, at least the way we think about this, is if you use a lot of historical data to identify patterns that can tell you something about the future, mm-hmm. and that you can then use to make decisions that change the process. Mm-hmm. So people talk about digital transformation, and then you ask them, what is digital transformation? You see a dashboard. Well, that's sort of like saying the LA Rams lost the Super Bowl because the scoreboard wasn't good enough. And if we're going to practice harder, let's have a better scoreboard. You're not going to win by a better scoreboard. There is a lot of historical data that every infusion center has about how many patients showed up and got chemotherapy done every day of the week for the last 3 years.
Right.
Which doctors did what surgeries in the ORs? How many mm-hmm. patients by disease type stayed in the inpatient beds for how long? Mm-hmm. Using this data to predict what's going to happen in the future mm-hmm. and tailoring the way we use capacity in the future. Really what machine learning, AI, etc., is only so useful as far as what it does. Frankly, where healthcare is a combination of natural intelligence with significant math can result in tremendous amount of efficiency. Mm-hmm. So the machine learning we use is looking at historical patterns to predict future patterns, to unlock capacity in every part of a hospital. Mm-hmm. So they see more patients and treat more patients, whether it's an infusion chair or an operating room or an inpatient bed. Hopefully that made some sense.
Yeah, absolutely. And I would assume also it would help with the decision of the institution in terms of how much they're going to buy in terms of equipment and
this is a really big point. So let's just parse that. Healthcare historically, most institutions we work with have always thrown supply at the problem.
Right.
If I'm going to see more patients, let me get more nurses.
More
equipment.
Chairs, more equipment, right.
Instead, before you buy a second robot, are you sure you've used your first robot well?
Right.
Before you buy your second IMRI, are you sure you're using the first one well? Mm-hmm. And this is another huge advantage. If you think about what this does, mm-hmm. significant improvement in the patient experience, mm-hmm. significant lowering of unit cost because now I can see more patients during the day. Much higher patient access. I can get access to care when I need it, which is by far the biggest problem in U.S. healthcare.
Right.
Fourth is much more revenue. Because now on the same day, if I used to treat 50 patients, I treat 60. In the same fixed cost, in the same variable cost of chairs and nurses and other infrastructure, I'm making more money as a hospital, right? And the 2 or 3 softer benefits are I can delay capital investment. Mm-hmm. I can now say, I used to think I can only treat 50 patients, but actually I can treat 60, which means until my demand goes up to 60 patients, I shouldn't have to build more.
And if you're passionate about digital transformation and want to come on our show, please don't hesitate to contact us at dtv@infostretch.com. We would love to have you on.